Okay, hi everybody. This week we are going to be learning about the female reproductive system. So we talked last week about the male reproductive system. Now we're going to do female reproductive system. So the purpose of the female reproductive system is, of course, to make babies. So it's designed for fertilization and for the implantation of the zygote and then the development of the baby. So it's actually pretty fascinating too. So there are different organs of the female reproductive system. That includes the ovaries, which are here, the uterus, which is here, and the cervix, which connects the uterus to the vagina, and the vagina here, and that's the internal. Oh, and also these are the fallopian tubes, and that's the internal reproductive system. For the external reproductive system, we have the vulva, which includes all the outer genitalia. That includes the clitoris, labia major, and minor. We learned last week that a male is always producing sperm once he hits puberty, and he will continue to do that until he dies. But for women, that's not true. They start ovulating during puberty. So sometimes that's used to be around like 12. And when I was young, that was pretty common, 12, 13, 14. But now it's younger and younger. So it's not uncommon for a girl that's 10 or 11 to start going through puberty. And people are not really sure why that is. And there's a couple of hypotheses. But it starts at puberty and then it continues on until menopause. And menopause can happen anytime between 45 and 55, and probably a little bit before that or a little bit after that, but in general it's between 45 and 55. Okay, so the eggs, once a month, once every 28 days, an egg is released in the ovaries, and then during that phase is when a woman can become pregnant. Okay, so this is a close-up of the ovaries here. And this is where the eggs are stored. So a woman is actually born with all of her eggs, so she doesn't make eggs anymore. But each month, one of them will mature, sometimes two or more, usually just one. An egg would mature. So we're going in this direction. So the beginning of the menstrual cycle, the egg starts to mature. And it gets a little bit more mature, and then it's a mature follicle, and then the egg will be released. And then we'll have this, it's called corpus luteum. So this empty body, corpus means body, and I think luteum might mean yellow. So this empty body that also continues to release hormones, and then it gets absorbed in cycles. So it's every 28 days this cycle begins, and then again and again. Okay, so that is the ovaries. And the uterus is the place where, if there were fertilization, the baby would be implanted here. Actually, implantation happens as the egg is released in the mid-cycle. So it's day 12 or 14. Of a woman, and then that's when an egg is released, and that's during ovulation. So that is like 14 days or 2 weeks after the first day of her period. Okay, so during ovulation, an egg is released, and the sperm actually have to come up the vagina through the cervix all the way past the uterus, and it actually meets the egg way up here in the fallopian tube. So, and the egg has to travel, fertilized egg, if it is fertilized, has to travel all the way down, and then the egg gets implanted in the uterus. Sometimes, though, for some reason, an egg might get implanted in the fallopian tubes, and that's a tubal pregnancy, and that could be dangerous to the woman. So, and the baby can't survive, so that's a really tragic thing that can happen. And sometimes, too, I mentioned that one egg can be released, but occasionally another egg can be released. So often it's alternating sides. But for some reason, some women ovulate twice, have two eggs that are released at the same time. So that's why you can have fraternal twins. So fraternal twins are twins that have uh, uh, just like siblings, are not identical. So they uh, uh, have similar chromosomes, but not exactly the same. And that's because a woman will ovulate two eggs. And then also women take, if they're trying to get pregnant, they might take medication to make them ovulate more eggs, so that you can also have pregnancy that way too. Okay. Okay, so it's actually in the uterus that the baby gets implanted, the zygote gets implanted. And then it secretes a lot of interesting hormones to tell the uterus to send blood, and then eventually a placenta is formed and then the baby grows. But if fertilization does not happen, the egg passes through, and then a woman begins to menstruate. So the lining of the uterus is released, and as well as the blood and cells. Okay. So I mentioned that the cervix, which is this area, so we talked about the uterus. Now going into the cervix, which is this area, is the entry from the vagina here into the uterus. And actually the cervix is pretty interesting. It kind of looks like a donut. And for a woman who gets a pap smear, the doctor will, or a nurse practitioner, will take samples of cells that are located right in here. And often this area could have cancer. So, so cervical cancer is a possibility. And that's caused, I think, like 98% of the time, or even more than that. It's caused by the HPV virus, which is fascinating because it has evolved to really know how to get into the cells and kind of start to cause cancer. So it'll change the chemistry, change the anatomy and chemistry and physiology of the cell, so it becomes cancerous. So it can become cancerous. So having the HPV vaccine can prevent that cancer. So you can get cancer, cervical cancer, and also you can get oral cancer from the HPV virus. So, and that's thought to maybe in part be due to oral sex as well. Okay. But for many women, it's kind of complicated. It's not uncommon to have abnormal cells. So sometimes if a woman has a abnormal pap, depending on her age and the circumstances, they may just wait and see if the body clears it out itself. But it's always important to see what your doctor recommends, because that is cancer. So, but because these cells are always changing, their epithelial cells, so they're always dividing, and you're getting rid of them. So the possibility is you can just, not have those cells; they'll get released. But it's always good to check with your physician, and it depends on how severe the precancerous cells are. Okay, and a woman, make sure to get a pap smear, what your doctor recommends. And talk about getting the HPV virus immunization. You don't want to get the virus. Get the vaccination. Okay. So as I mentioned, this is the ovaries that we talked about, and these the ovaries also secrete hormones. So so this will be secreting hormones too. Okay, and then here is the vagina, which is the receptacle for the penis during sexual intercourse, and that contains a mucus layer and a smooth muscle layer. So the mucus layer not only secretes mucus, but also contains immune cells that help aids in the transmission of AIDS. So it's kind of tries to protect the woman. So it could be a little bit acidic. It could, the mucus helps get rid of some of the viruses and other things that can go on. Oh, and also just right here, the cervix too, actually also kind of blocks sperm, kind of prevents sperm a little bit when the woman is not ovulating, because it doesn't make sense to have sperm to go up if a woman's not ovulating. Of course, there'll always be sperm going up, but when a woman is ovulating, then this area changes, so it kind of encourages the sperm to go through. So even though you might not want to be pregnant, your body is designed to get pregnant. So one of the things is, a woman might notice her discharge changes from like a little clearer. And that's because this part is changing too, because it's allowing more of the sperm to come in. I know it's fascinating to see how just little changes in the body can really help get a woman pregnant. Because, yeah, the whole goal of life is really to eat and procreate. So that's our goal. It's animals. So then that's a goal of many other animals too. Okay. So the external part of the female genitalia, it's called. What I found on the web for is really sorry. I have my cell phone here. That's weird. That never did that before. Okay. So the vulva includes, of all the things to suddenly listen to, that includes labia major and minor, and the vestibule, and the mons pubis, as well as the clitoris. And I had an image there. I'm not sure where it went. Let me find a good image so I can exactly show you. Okay, so here is labia majora or major, or labia means lip. Labia minora, the smaller lip. Here is the vagina here, the anus here, and the urethral opening where urine comes out, and the clitoris here. And some of these are analogous to the male genitalia too. So the clitoris is analogous to the tip of the penis. So during development, men and women are similar, and then as they get during early development, they change so that the clitoris, the tip of the penis, is homologous to the clitoris. Okay. Okay, so moving down, that's the vulva. So moving down to the breast or the mammary glands. So the purpose of the breasts are for a woman to produce milk for her baby, and the milk that she produces is perfect for the baby. So it has the right protein, fat, other nutrients that the baby needs, and also antibodies. So it really helps with the immune system of the baby, because when a newborn baby, doesn't have a really good immune system, so it has some protection from the mother during breastfeeding. So it's a great, and it's cheap too. It's free. So it's amazing that the woman is able to produce breast milk that's perfect for the baby. Okay, so the anatomy of the breast. We have lobes of the mammary gland, so this is where the milk is produced. And during pregnancy, the hormones will turn on those lobes, and then milk will start to be ready to be made. And then right after birth, that will allow the milk to be released. We have the areola and the nipple where the baby latches onto. Lactiferous sinuses are here. So they kind of are made and they're collected here. We also have a lot of breast, so a fat, so a lot of fat is in the breast. And some women have a very dense breast and other women don't. So sometimes if a woman has a dense breast, it might be a little more difficult to get a mammogram. And for some reason, the breast has a higher rate of cancer. So it's important for a woman to get breast cancer screenings, and depending on your doctor, always ask. Sometimes that could be in the late 30s, but often it's 40 and then up until she's older. Because for some reason these cells can have changes in them that can be cancerous. Sometimes it can be benign. Oftentimes it's benign, but it's always good to check. Okay, so I'll stop here and we'll talk about the cycles.